You do have the ups and downs. It's not always rainbows and butterflies around, but I do think that Filipino nurses are really good. I mean, a lot of British nurses that I work with, they do say that Filipino nurses are very hardworking. So they just love working with us. I would also say that our curriculum, our training back home is better compared to some of the universities here. It's not easy, but it's manageable. Being in intensive care, it should be one-to-one nursing, especially for patients who are put on induced coma. You do have to keep an eye on their airway because basically they are not moving, they can't breathe or on their own. So we need to make sure that all the machines around them are working properly and of course that they are okay. So from 1-to-1, we had to be looking after, the most I had was about 3:1, so 3 patients to 1 nurse, which was very difficult, especially wearing all the PPEs. Yeah, it was just like from one to another. It was just nonstop. Of course, with the virus as well, we learned a lot of things with the virus, how to handle the patients, the compromises that we have to make, the compromises that the patient has to make as well in order to, I suppose, be alive. It was a real eye-opening that life is very short, that the pandemic didn't just affect the old people, but also the younger ones. I think we had as young as 28 who passed away, which was very sad, obviously. But yeah, a lot of us also had stress-related absences. It was something that I did not expect to experience in this lifetime. No one did really. Filipino nurses are just, I suppose we're very flexible. We still get to find how to have fun in times of crisis, really. I mean, that's just how we are. That's just how we do it. Maybe it's just a bit of a Filipino mentality as well, that we'll be okay, that we just have to work, we just have to get through things and we'll be okay. In my head all the time, I just think that I can't complain, even though if it's busy, I shouldn't complain, because at the end of the day, I'm going home and a lot of these people are not. In my head, I just always think that my family are okay, my mom and dad are okay, so I should not complain, I should just carry on. So I think that helped me to perk up, that helped me to not let it get me, not let me get down, and just try to work as hard as I can and help all of these people. I just want to think as well that if, the big if, one of my family member is in the hospital, I would like to think that there are a lot of there would be nurses that would look after them and would try their best to look after them. One of the things that concerned all of us is, what if we take this home? What if we take the virus at home and make our loved ones sick? It just hits you every time when you have, let's say, a talking patient, and then next thing you know, they deteriorate, they get intubated, and then they just get worse, and then they pass away. So, you have established that rapport, you've established that relationship with these people. You've known them, even though just for a short period of time, you get to know their family. When they do video calls, you get to know them as a person, not just as a patient, and the next thing you know, they die. So I think that's one of the things that got us and made us, I suppose, depressed in a way. And it being quite the norm, it being normal, because that's just what's happening. That was just not right. But what can we do? So I still come home. They did send us the lateral flow test, which is the one that you swab yourself and then you test yourself. So I was doing that twice a week just to make sure that I'm okay. At the same time, I did buy a special mask. A few of us bought this special mask where we can reuse it, and it's got like special filters as well. Not that we don't trust the masks that our hospital provides, but we just feel a bit more secured and safe with the mask that we bought ourselves. They're not cheap, but you can use it for a longer period of time as well, and it's more comfortable, and you can breathe better. And that gave a lot of us some peace of mind that this would help us not get sick, and this would help us not to pass it on to our family as well. But apart from my immediate family, we've not seen anyone else. So I've not seen my in-laws, I've not seen my other nieces, and I mean my mom and dad, I've not seen them either for over a year now.